Hi, I'm Dr. James Nill of Nill Family Chiropractic and Wellness Center, and today we're going to talk about leg pain, which some of the people, a lot of them refer to as sciatic pain. Now, the majority of sciatic pain, or pain shooting down the leg, originates actually up here in the low back, which a lot of people don't realize. Even though you have pain down the leg, the actual problem's up here. So a lot of the causes of that could be a disc herniation or disc bulge, and these are discs in between each vertebrae, which can actually put pressure on a nerve root and send that pain shooting down the leg. Another problem could be what's called piriformis syndrome, which is a muscle that goes from the pelvis over here, and the sciatic nerve actually goes underneath it. Now sometimes that nerve can actually go through the muscle, or like I said, go underneath it, and the muscle can be tight, causing that pain to go down. If you ever crossed your legs and your legs started going numb, that's because that sciatic or that piriformis muscle is pressing on that sciatic nerve, and that's when you release that leg, it actually goes away. And you can see the piriformis muscle is actually coming from the greater trochanter or femur and coming across here to the sacrum. And you can see how when you cross your leg, that can pull that muscle tight and actually cause a pinch on that nerve root, which is the sciatic nerve, and that's where you get that pain sensation going right down the back of the leg. Now, what I do to treat sciatic pain, especially if we found out it's coming from the low back, is we start out with what's called anodyne therapy. Anodyne therapy, you can see these pads right here. These are just little diodes that release light. The light is 890 nanometers, which is absorbed by the red blood cells. Red blood cells release nitric oxide from the hemoglobin, which is a natural vasodilator, which opens up the blood vessels and it flushes out all the inflammation, and that way it takes the pain away. So I'm going to put it down here over the source area, which is what I found out during my initial exam, by the way, or sometimes we might have to get an MRI done. So I go like this, we set these on, and they sit there, and she's going to lie here from 8 to 15 minutes, or maybe even longer, depending on how much inflammation she has going on in there. The next thing I want to do is actually do mechanical massage in the area. Now you can turn this on, and you can actually hear it in there. What this is doing is it's actually loosening up the muscles in the deep area in there. Now, everybody gets this, but I recommend to all my patients that they go across the hall to the massage therapy clinic and actually get at least a half hour of deep tissue massage to help loosen up some of the muscles that are contracted in there. The next thing we want to do is what's called myofascial release. We're actually going to come in here and we're going to do some stretching on the low back. And we do this between 8 and 15 minutes to try to do this. Now what we're doing is actually on top of each muscles, there is a layer of fascia which gets restricted in there. And by doing this, it helps break that up and it releases the muscles' tension. Now from there we move into what's called flexion distraction therapy, where we actually go in between each segment, and depending on what causes the most relief in her pain, we turn the table to that segment, and we actually go from each vertebral segment, and it helps release that. On top of that, we actually have what's called a little traction on it, and that helps pull the vertebrae apart, and then we get really specific to each area. Now what I'll do is I'll ask her what feels best. Sometimes you go up, sometimes you go down, and depending on what helps relieve it the most, we stay in that area and we go up and down. As I mentioned earlier, sciatic pain can also be caused by a muscle that actually comes around here called the piriformis muscle, and the sciatic nerve goes underneath. So what we're going to do is we're going to do a piriformis stretch. So push on me real hard here. Now take a deep breath in and out and relax. As you can see, it kind of goes a little bit further. This is called P and F stretching because she's actually pushing on real hard. Keep pushing. Push, 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 push. Take a breath in and out and relax. And what that does, it helps stretch that muscle and help relieve that tension. Now she can actually do these on her own. I'm going to have her just bring this knee up, put your arms underneath your legs, right here, your thighs, and then you can get that same stretch sensation that way.